Hi, everyone, and welcome back. My name is Dr. Samantha, and I'm the maternity mentor. And we're here again for another one of our live Q&A sessions that we have here every Monday at 9 p.m. Eastern Standard Time. This is a time where you can ask any questions that you might have for me live. You can just put those into the chat. And we also take this time to answer some of the questions you guys have submitted onto our videos this week. Remember, you can follow us on Facebook, Instagram, and Twitter for additional content. Those will be linked into the description. Also, remember to share this channel with your friends and family. Please like and subscribe to the channel. It really helps me out. And if you stay until the end, I'll give you a sneak peek at tomorrow's video. So again, if you're joining me, thank you so much. And I'm going to go ahead and I'm going to get started with some of your questions that you guys have given me. So we're going to start with bleeding. We had a couple questions that have happened or that came in on bleeding. The first one said, I'm 8 weeks bleeding, or I'm 8 weeks pregnant. After intercourse, I'm spotting a little bit of blood for 3 days. Should I worry? So bleeding is one of the most common questions that I get. And I think these questions are very important because bleeding is very scary during pregnancy. When we see blood, we don't know what's going on. And of course, the first thing we're thinking about is miscarriage. Your pregnancy is full of a lot of different hormones that do a lot of different important things in your body. And some of those hormones, they will thin out the vaginal tissue. So having bleeding or spotting after sex is very common. And so you may see that, and that's normal. And that's because that tissue is very frail. However, you don't want to just dismiss this as normal vaginal bleeding because I had sex. You want to instead contact your healthcare provider so that they can go ahead and they can assess the situation. There's lots of different reasons why we might have bleeding that is normal, including having a subchorionic hemorrhage, which we can link a description to that in the description, to having different placental positioning, like a placenta previa or something like that, which could also cause this. But separate of that, there's other things that are not normal that we want to go ahead and take a look at to make sure we can get those treated, like a vaginal infection that doesn't necessarily have to be a sexually transmitted disease. You could also have a urinary tract infection that's actually causing issues. So you want to make sure you contact your healthcare provider. But, if you have bleeding after intercourse, it's often very normal. And you just want to let your healthcare provider know what's going on and keep them abreast of the situation. Now, I had another interesting question about bleeding. This one is actually postpartum bleeding. So I am bleeding for 2 months after the birthday. The bleeding stops for a few days and then continues. After 2 days, it's not heavy, but I'm worried. Okay. So this is a very important question. So we have bleeding postpartum. What does postpartum bleeding look like? So postpartum bleeding usually lasts from 2 to 6 weeks postpartum. This doesn't matter whether you have a vaginal birth or a C-section. Usually the first 24 hours in the hospital is the heaviest bleeding that you're going to have. By the time you're leaving the hospital, it's usually about the amount of like a heavy period. A lot of women within 2 weeks will report they don't have any bleeding at all. It is normal for a vaginal birth to have more bleeding than a C-section because while they're doing your surgery, they kind of suck up as much of the blood as they can before they close you up. So you can have normal bleeding up until 6 weeks after you give birth. Now, that bleeding goes from bright red to dark red to like a dark pink, light pink, clear, and then you're done. Sometimes you will have bleeding for longer. Now, when is it an issue? For starters, if you have heavy bleeding that persists for 3 or 4 weeks, that's a sign that there could be an issue, specifically that a piece of your placenta stayed inside the uterine wall and is stuck there. One of the other signs of this, besides heavy bleeding and passing clots, is that your breast milk supply won't come in because the hormones aren't the right balance for you to make milk, because that piece of placenta is still sending a signal to your body that you are actually pregnant when you're not. Now, another thing that could have happened in this case is that this could be your period. So a lot of women, especially if they're breastfeeding, assume they're not going to get a period for a very long time. And this, when I say a long time, 3, 4, 6 months down the road after giving birth. And even women who aren't breastfeeding kind of figured they're not going to get their first period for about 3 months. That's actually not the case. You should assume from the moment you give birth that you could be ovulating, which means you're letting out eggs, which could be fertilized, and you could get pregnant again. And therefore, you could get a period at any time. A lot of women will actually regulate within those 4 weeks after giving birth, and you'll see that they get a period within 6 to 8 weeks after giving birth. So when she mentions that it stopped and then started again, that could be your body trying to get going for a normal menstrual cycle. And now your first menstrual cycle after giving birth could be weird. Okay, a lot of women will go, but this is not like what I normally had. It's not lasting the right amount of time. It's not the right. No, everything is different once you have a baby. For some women, the difference is awesome. For some women, not so much. So what do I mean by this? So there are women who unfortunately will have very heavy periods, very painful periods. Every month the period is really, really awful. And then they will give birth and everything gets better. For other women, you may be lucky that up until this time you had a short, light period with no pain. And now after giving birth, you might have a little bit of discomfort. So this is the other thing you guys need to know is your period can change its characteristics, length, time, flow, pain after giving birth because everything has changed down there. Okay. So for this mom who's mentioning that she is bleeding 8 weeks postpartum, without knowing for sure what's going on, you need to contact your healthcare provider. They're probably going to need to do a ultrasound of your uterus to make sure there's nothing going on. They also are going to want to look at your cervix to make sure you don't have a cervical laceration, okay, which is a cervical cut that could get infected if it's not treated. For those of you who are joining us, welcome, welcome. My name is Dr. Samantha, the maternity mentor. Thank you for coming back. Please feel free to put any of your questions into the chat, okay? The next question that I'm going to answer is about acid reflux. So I'm 6 weeks pregnant and I feel like something is stuck on my throat. Please help. So acid reflux, unfortunately, is extremely common during pregnancy. Why does this happen? So for starters, your stomach, there's a lot of pressure that gets put on your stomach. So as a result, you end up having that acid kind of pushed up into the throat. And so that can be very irritating. But another reason why acid reflux becomes an issue during pregnancy is because of the hormone relaxin. So relaxin over time is designed to relax all of your joints to allow for a baby to be delivered vaginally because the pelvis is very tight and we need it to open up to allow for a baby to come out, right? Now, relaxin is also that hormone for those of you who have ever heard, like sometimes women will say their nose got bigger or they say their feet get like flatter and wider. That's relaxin. Unfortunately, that's the hormone that also causes that. But it serves a very important purpose. Now, relaxin will also unfortunately relax the sphincter at the top of your stomach and the bottom of your esophagus, your throat. So the sphincter is a little muscle that kind of goes like this and it closes off to keep the stomach acid from coming up, right? But the relaxin kind of keeps it more open than it normally would be, which allows for that acid reflux. So these are some of the reasons why you can develop acid reflux. And we have a video on this that you can like learn more about like some of the treatments and stuff like that. So this is why it's happening. Now, in this case though, there's actually something interesting. So she mentions, and I'm going to read it again, feels like something is stuck on my throat. So right here, guys, right about here is your thyroid gland. The thyroid gland is the single most important organ in the body, in my opinion, because what a lot of people don't realize is that thyroid controls so much of everything else. So like people will say, oh, it's my heart. Well, too much thyroid and your heart is racing. Too little thyroid and your heart is barely pumping. Oh, it's my brain. Well, nope. If your heart is racing or not pumping enough, you don't get enough blood to your brain and therefore you're foggy headed, you're fatigued, or you can't sleep. So you're insomnia. This is all caused by the thyroid. And there's so much more. It affects every system in your body. Well, the thyroid is very notorious for acting up during pregnancy. The hormones that are related to having a healthy pregnancy, for whatever reason, kind of mess with the thyroid gland. And as a result, it's very common for women to develop thyroid issues during pregnancy that need to be treated. Or it's very common for women who might have been creeping into a thyroid issue to go ahead and need to receive treatment, right? So that throat, stuck in the throat feeling, that could actually be the thyroid gland. So the thyroid can swell, causing a goiter. And a goiter is something that can cause you to have trouble, like feeling like you're going to swallow wrong, right? So that goiter, if left untreated, can actually be the cause of that kind of feeling, right? So it's very important for you to get this checked out. You don't want to just assume it's acid reflux. And just so you know, even if you are having acid reflux, you still might have an issue with the thyroid gland. So don't just assume that it's acid reflux. Now, what are they going to do? They're going to have you come in. They're going to feel it. They're probably going to do an ultrasound, and they're also probably going to do some blood work. Okay. So these are some of the things that they are going to go ahead and do for that. For those of you who are joining us, welcome back. My name is Dr. Samantha. I am the maternity mentor. Please feel free to ask any questions that you have in the chat. Getting back to some of the questions that we have, I had a question on vaginal discharge. So it says, I'm in my 7th week and I've been experiencing a thick, white, jelly-like discharge since week 5. So let's talk about vaginal discharge. There's a lot of vaginal discharge that's normal, and there's a lot that's not. The reason why vaginal discharge is important is because it gives us a glimpse into vaginal health. And it's very important that you don't have any infections in the vagina, because an infection in the vagina can travel into the uterus, infect the uterine lining, and this can actually cause a miscarriage. So the different discharges are extremely important. And we have a video on the colors of bleeding and what they mean. And it also lists some of the colors of discharge. So white discharge. White thick sounds like yeast. Okay. And I have a video on yeast. Yeast infections are common during pregnancy because the vaginal flora changes. All the normal bacteria that should be there, it kind of gets thrown off by being pregnant. And as a result, women can get a yeast infection. Now, there's a couple important things, and I actually have a couple questions on yeast infections and the medication, so we're going to do those next. You can't just take yeast infection medication just because you can find it over the counter. So yeast infection medications, some of them are safe and some of them are not safe. But it is important to treat your yeast infection because yeast is very notorious for causing uterine infections that can lead to preterm labor. So how do we know that this is that versus a normal discharge, which can be white and definitely can be thick and jelly-like? The way we determine that is we bring you in to examine you, and we'd use a cotton tip, a sterile cotton tip swab. So it's like a long Q-tip, but it's sterile. We have a speculum that we put in so we can see the cervix and see your discharge. And then we're going to go ahead and swab that and send that off to a lab, okay? And that lab's going to tell us what it is. It can tell us whether it's normal vaginal bacteria. It can tell us whether it's semen. It can tell us whether it's urine. It can tell us whether it's yeast. It can tell us whether it's viral or bacterial. And then from there, we can determine the course of treatment. It is very, very important, and I cannot say this enough, that you guys go ahead and make sure you ask them to check your vaginal discharge if you're not sure what it is, to make sure it's not an infection, because infection is like one of the number one things that can lead to a whole bunch of complications during your pregnancy. So we really want to get it taken care of. Hi, Sarah. I'm 34 weeks pregnant with twins, 80% effaced, only slightly dilated. I have Ehlers-Danlos syndrome and was wondering if this will affect the speed of my labor. I don't want to have an accidental home birth. Okay, so congratulations on twins, 34 weeks. Already, that's like a feat. For those of you guys who don't know, Ehlers-Danlos is a type of autoimmune disease. So autoimmune diseases are diseases where your own body kind of attacks itself. And in her case, it leads to very hyper flexible joints. Okay. And so if you've ever seen somebody that can like basically like twist their fingers in all sorts of weird ways, this is somebody like that. Okay. So it is actually a really great question. And I don't know that it is going to affect the speed of your birth because the cervix is not a joint, but you are 80% effaced. So for you, those of you, I'm thinking this through, Sarah, to give you a really good answer. So let me talk cervix while I'm thinking about this. Cervix, so you got your uterus, cervix is at the bottom. It should be long, thick, closed. Okay, that's what a cervix should look like. And what happens is over time, the contractions spread this apart. So when it's closed, there's a little lining of mucus there because you can't be fully closed or else this wouldn't open for a baby's head, right? So that when this starts to dilate, that's what causes the mucus plug to come out, okay? Now, going this way, as you have contractions, the contractions are designed to take this long cervix and make it shorten, right? You see how that's going on? So that is effacement. That's what effacement is. We go from thick, which is like 0% effaced, to thin and then out. Okay. And as it goes out, that's where you start to dilate. Now, sometimes when you're kind of here, you will start to have the cervix open as it's finishing its job of effacing. So that's why she's 80%, 100% is fully effaced. It means it's like basically like nothing's there. And then you dilate more and more and more. So I will tell you that it would depend, Sarah, I think, on the position of the twins. And if you have a baby that's head down, actually, it could. So when a baby's head is down against the cervix, it helps to put pressure on it so it'll start to dilate open. The thing is that one of the things that kind of keeps babies up is a pelvis that the relaxin hasn't fully relaxed that pelvic joint so that they can't drop. Right at the very end of pregnancy, when you guys hear about somebody who says they look like they dropped, what they mean is that the baby's head, who's kind of floating, drops into the pelvic area. It gets lower, which is its start to going down for a delivery. So if one of those babies is actively engaged into the pelvis, then yeah, it might be, it actually might be an issue because it might cause them to kind of engage into the pelvis. But I still think you'll be able to get to the labor and delivery suite on time. I would tell you to monitor your contractions very carefully. So a lot of times they tell you to go to the hospital when they're 2 to 3 minutes apart, and or when they're 3 to 4 minutes apart, 5 to 6, depends on the doctor, lasting for 1 to 2 minutes. They have a whole criteria. I would say you probably want to get there earlier. I would also start talking to your doctor, though, Sarah, about whether they might want to have you go in a little bit earlier for monitoring. The Ehlers-Danlos shouldn't affect the labor, but you probably do get flares every once in a while, and this might actually cause a flare. So I definitely would say you might want to like ask them if they want to have you being monitored in the hospital at like 36 weeks. And the other thing is, of course, is this your first babies or your second or third pregnancy? That would make a difference. And I see you said they've dropped, so that is a sign that they could be engaging in the pelvis. Tell me if it's your first or second pregnancy, Sarah. Tess, hi. When do you stop giving a baby vitamin D supplements to a breastfed baby that has started solids? That is a good question. I don't think they've come up with a very definitive guideline on that. To be very honest, I'm going to tell you, I wouldn't stop vitamin D supplementation ever. I think every single one of us needs vitamin D supplementation across the board. Breastfed, formula fed. It's just a matter of making sure you have weight-based dosing. Vitamin D is absolutely one of the most essential vitamins we have. Unfortunately, it has been touted as the bone vitamin, so everybody kind of dismisses it. The other thing we hear is, oh, you can make it from the sun. Yeah, no, you really can't make it from the sun. It just doesn't work like that anymore. So let me explain. First of all, the ability to convert sunlight into vitamin D in your body, it depends on your melanin level. So melanin is what makes skin dark. So I have less melanin, which means I should be able to make vitamin D better than somebody who's very dark and has very dark skin. So first of all, if you're dark skinned at all, you're going to need more vitamin D supplementation than I would, because you're going to have a harder time converting it. And so that's a very big consideration. Second, how long are we out in the sun? Let's just call it. We're all kind of lazy nowadays. We sit in front of our computers and in front of the TV and doing all this other stuff. But in addition, what we don't take into account is, like, for example, I work in this office building with this big window. It's amazing. I get lots of sunlight. My office windows, though, have a UV protective film on them. So most of the windows that we're actually exposed to nowadays have UV window kind of filters on them. We wear sunglasses, we wear long clothes. We just don't expose ourselves to the sun like we used to. And then if you put on sunscreen, forget it. And we need sunscreen because the ozone layer is depleted and we can get burned and skin cancer. But every time we're doing these things, we protect our skin so that we cannot convert into vitamin D. Okay. Now, the next thing is, you might say, well, there's vitamin D in the food that I eat and this and that. But the thing is that there's other factors like digestion, like your microbiome, that would affect how well you convert vitamin D and whether your enzyme system will allow you to process it. So it's a very complex thing. Now, I'm telling you why we should supplement, but what does it really do in your body? Vitamin D is now known to be one of the most powerful parts of your neurotransmission system that we have. Neurotransmission, these are the chemicals that affect mood, like anxiety and depression, energy, motivation, concentration, memory. I can tell you that I test it almost universally across the board. For the patients that I find that are vitamin D deficient to the point that they need a prescription, I give them the prescription. And I have patients that I have put on vitamin D and they have not wanted to come off of it. They notice an immediate difference in what their body feels like and how well they function with this vitamin D. So now we get to little babies, like Tessa's baby, right? So we have this growing human being who I've just told you needs vitamin D for cognition and memory and energy. And so I personally believe that as long as your baby is not having adverse effects, as long as you're catching up with a pediatrician to make sure you're doing the proper weight-based vitamin D dosing, I think that regular vitamin D supplementation should be a part of the routine. The final thing I'm going to say about this test, and for any of you guys out there with babies, if you are giving a multivitamin to your baby and it has vitamin D in it, make sure you're checking that amount. Because if you give a multivitamin with vitamin D and a separate vitamin D supplement, you might be overdosing your baby. Okay? And overdosing of vitamin D is not good for anybody. Hi, Lampy. My question goes this way. What are the best meals for pregnant women and what are the meals they are to avoid? That is a fantastic question. So I have a video on keto, so we're going to link that into the description. Keto in a nutshell is higher protein, higher healthy fat, lower carbohydrates, which is lower sugar. The best meals for pregnant women are nutrient-dense meals. What does this mean? Whole foods, natural foods. So fresh fruits, fresh vegetables, fresh meats, okay? Fresh grains. We want to avoid processed food, okay? Now, you guys have probably all heard that like a million times. So I'm going to give you some other things about it. Sodium is not your friend. So where it's easy for me to say eat whole foods and whatever, the biggest thing is if you're going to eat processed foods, you need to keep an eye on the sodium levels. Try to make sure you're eating a reasonable amount of salt. Salt can be very detrimental to your health. Okay, it can contribute to swelling. It can contribute to blood pressure issues and the same. The next thing, let's talk about cravings. So isn't it notorious that pregnant women are known in the movies and the TV shows to have like these cravings, right? Like, oh, she wants pickles. So I just told you about salt, but salt is not always a bad thing. And if you think about pickles, why does a woman want pickles at 3 a.m, right? Pickles' main ingredient is actually salt. Why would she want salt at 3 a.m? Maybe her blood pressure has dropped. Okay, what about the woman who wants ice cream? Okay, now we can all say that ice cream is like comfort food, it's got sugar, like that's all really good. But ice cream is also protein. So your body may be craving a protein that you happen to like. And a lot of women who have these cravings, but they're under strict dietary guidelines because maybe they have diabetes, when I've pointed this out and they've tried to then work with the main ingredient in their craving, but supplement it with a healthier option. So the woman who wants ice cream, we go ahead and we give her say string cheese, or the woman who has the salt craving. So maybe we use a lower sodium, like salad dressing, something like that. Those substitutions often fit the bill. They often are actually helping a woman to kind of feed her body. Your body knows what it needs and it's going to ask you for what it needs. So the last thing is, like, let's say you do want ice cream. Okay. Ice cream is not evil. We just need to eat it in moderation. Lampy, ultimately, my biggest thing is keto. Keto is like my favorite thing because it's low carb. I do not recommend women follow calorie restrictions. I do not recommend you do keto where you're counting the macros. For those of you who are familiar with keto and really gung ho, there's like a calculation system of macros. I'm not even going to get into it because I don't recommend it. Instead, I recommend the keto food list and using common sense. Don't overeat, eat with, regular meals. I think small meals and snacks are way better than these big, large meals because, as we talked about before, acid reflux, too big of a meal, and it's going to be an issue. So that's what I really go for. High protein, high healthy fats, low carb, low carb. Sarah, first pregnancy. Yeah. If the babies have engaged, I do think you need to be paying a big mind to like your contraction pattern. Make sure you're staying well hydrated. Dehydration can absolutely mimic labor, and then you're going in for what you think is false labor. Keep an eye out. I would take a look at the 10 signs of labor video that I have, but keep an eye out for all the signs. If the babies stop moving the way you normally would expect it, definitely call them. One of the signs of labor can be that. Don't dismiss lower back pain. A lot of people think lower back pain is nothing. They get this cramping that kind of comes and goes in their lower back and they just dismiss it. And that can actually be labor. That can actually be active labor. My guess is you've been followed by a high-risk doctor or maternal fetal medicine. I would be talking to them about, like, what's the plan? Should you be stopping work early? Being on your feet with Ehlers-Danlos and two heavy babies engaging into the pelvis is definitely a high probability of having babies early. And then, in case you didn't know, Sarah, check out my twin delivery video because delivery of twins happens very differently than delivery of the rest of our babies. For those of you who are joining us, I'm Dr. Samantha, the maternity mentor. Hi, welcome to my live Q&A. If you have any questions, please put them into the chat like Tess and Sarah and Lampy have done, and I will answer them. And otherwise, I'm going to answer the questions that we've gotten on the videos. I had answered the question about like the discharge, vaginal discharge earlier, and I said that we had a couple questions on yeast, so let me do those. So we had two different questions about using medications for yeast infections. So the first one said, I'm currently 26 weeks pregnant. My doctor recommended Myconazole 3 to me. Is this 100% safe to use? I'm always so paranoid. I used it for the first time yesterday. So Myconazole is one of those over-the-counter yeast infection medications I was talking about. So ladies, you cannot just grab a medication off of the shelf and use it. You cannot do this. Pregnancy is a very different time in your life, and these medications, while they might be safe at other points, are not safe to just randomly use. Let me give you an example of a benign reaction. Benadryl. Benadryl is a great medication for allergies. It has a very good safety protocol. It's very useful. Benadryl can dry up your breast milk. So that's an example of why you can't take Benadryl. It's not going to hurt the baby, but it could absolutely interfere with some of the things you need it to do. Myconazole is safe for use, but not in the first trimester. So this mom is 26 weeks pregnant. That means she's into the second trimester. So this is okay. But you heard that in the first trimester, miconazole is not safe for use during pregnancy. There is a higher risk of birth defects. So this is why it's so important for you guys to check it out. Now, the other thing with yeast infection treatments is that some of them are creams and some of them are like the suppositories where you have to kind of stick them up. So there's different ways that you might administer the medication. Depending on your risk profile, your OBGYN may not want you to use a suppository, or they may not want you to use a cream, which is the other reason why you want to ask. Now, finally, look at the miconazole thing. You can't assume you have a yeast infection and go grab something, because what if your discharge is something completely different? So not only is the miconazole not going to help, now you've exposed yourself and the baby to something that won't even work, and then you might still need another medication. Now, the other question said, recently I was diagnosed with a yeast infection and took 2 pills of fluconazole over a 2-week period. That is 300 milligrams of the drug. Now I find that I am pregnant. Must be a week or 12 days. Because before that, I had my periods. Now I'm very concerned about how all of this will affect my pregnancy and the baby. Please, could you tell me what effect the drug will have? Is it dangerous? Okay, so fluconazole is a medication that is used as a pill to treat yeast infections. If you read about fluconazole online, you're going to see that there's a lot of stuff out there that says it's dangerous. And so I want to make sure that we're clear on this. Fluconazole at high doses, so that's usually considered 400 to 800 milligrams per day, is probably hazardous, is most likely going to cause birth defects. So this is not recommended for use during pregnancy. However, for vaginal yeast infections, we often use fluconazole at much lower doses. So as this viewer said, she took 300 milligrams over 2 weeks. She basically took 150 milligrams week 1 and 150 milligrams week 2. At low doses, less than 200 milligrams per dose, fluconazole does not appear to be an issue at all for a pregnant woman. It can be used during the first trimester as long as the benefits outweigh the risks. This highlights something that I talked a little bit about last week, and I encourage you guys, not only if you're not pregnant now and you're planning on getting pregnant, or if you get pregnant again, or if your friends are thinking about becoming pregnant, if you are a woman of childbearing age and you are not protecting yourself from pregnancy, you need to ask all of your healthcare providers to medicate you for everything as if you were pregnant. So that means when they pick an antibiotic, they pick one that would be safe for pregnancy. When they decide to use a yeast type of treatment, they do it as if it was safe for pregnancy. If you need blood pressure medication that's safe for pregnancy. Because if you were not preventing pregnancy and you're of childbearing age, you could be pregnant at any time. This happens. It happens all of the time. And so you want to make sure that you are protecting any future pregnancies so you don't have to have this concern. Okay? For those of you who are joining us, please feel free to put any of your questions into the chat. That's what we're here for, and I love answering your questions live. So I got a question this week on pacifiers. Is it safe for my baby to sleep with a pacifier clip attached to the clothes or while sucking on the pacifier? So for those of you who don't know, a pacifier clip is just a little clip that kind of keeps the pacifier attached to the clothing, so you don't lose it and it doesn't drop on the floor. Pacifier clips are not safe for use during sleep. Okay, so I'm so sorry. I used to use them all the time, but we have now learned that they are at high risk for contributing potentially to SIDS. So SIDS is sudden infant death syndrome. Basically, what we're starting to learn about SIDS is that we need the least amount of stuff around our babies, okay? Because they don't really know the full cause. There is some evidence about overheating being an issue with babies and SIDS. But there is also some evidence about babies being too deep of a sleep, which is why pacifier use is recommended during sleeping. And there's also some mentions about the fact that we have all these artificial things that are in babies' vicinities when they're sleeping that wouldn't have normally been there in caves, and that this may cause positioning issues that babies can't correct themselves, and therefore they get stuck in positions that put them at risk. So one of the things that happens with SIDS, everybody wants to put babies on their sides because they're worried about vomiting. What people don't realize is that, you know how like all these newborn babies, we're always like, oh, watch the head, the baby's neck like is all wobbly. It's true. The baby's neck is very loose and the neck muscles aren't fully developed. And the head is very big and heavy because we have big giant brains when we're born, but the rest of us is kind of immature. So the thing is that this area, just like the neck is weak, this area, the throat, is also loose and weak. When you put a baby onto their side, right, they don't have the muscle control yet to be able to straighten up their trachea. Okay, so you have two tubes going down your throat. You have the esophagus, which goes to the tummy, and you have the trachea, which goes to the lungs. And so when a baby is little like that and they don't have this good, strong muscle control, they end up, you put them on their side and you're thinking they look good, but what's really happened is they've compressed that tube, that trachea, making it harder for them to breathe. And they don't have the muscle control to go on their back. The other thing is to keep a baby on their side, right? We usually prop a blanket behind their back to keep them that way. And then they really can't correct it. Okay. So this is why we think that back to sleep is not good. But if you actually think about it, when a baby is on their back, this whole area is now stretched out and that trachea is wide open. And babies have a very good ability to throw up everything they need to throw up and not choke on it, which is what we're all worried about. And if you guys are wondering about throwing up and spitting up, I actually have a video on that and we'll link that into the description for you. So going back to the pacifier. So pacifiers are recommended by the American Academy of Pediatrics once breastfeeding has been established, if you choose to breastfeed, for use during sleep. The reason why pacifiers are being recommended for sleep is because they seem to keep babies in a lighter state of sleep. As much as we're all dying for lots of sleep and a kid who sleeps through the night for 8 hours, a lighter state of sleep, especially in the newborn, is protective. Okay, that lighter state keeps a baby kind of breathing faster, and they'll startle reflex more, and those are all really good things because it helps a baby to stay in a more awake state, so it puts them at lower risk for SIDS. One of the things that I also really like, which of course most parents would hate to hear this, I don't like swaddles, and I really like it when babies are allowed to do this. So the swaddle helps keep the baby calm, okay? The baby was used to being all crunched up in your belly. Arms were usually tucked in and folded. So as a result, they felt really secure that way. And of course, they can't do that startle reflex, which wakes them up. The startle reflex keeps a baby in a lighter state of sleep, which is protective, okay? So one of the things that you should be aware of is that that's one of the things that helps protect a baby. Now, the other thing is when the arms are like this, okay, baby can't roll onto their side and potentially onto their face where they can't breathe anymore. When we bundle our babies up, now the baby could roll all the way over and there's no way to stop it. And they're too little to be able to correct that. So understand swaddles are these amazing things to help our baby sleep, but really they aren't very, a really good idea, in my opinion. When you're talking about a pacifier, I love pacifiers. I think they should be used because of their safety mechanism. The pacifier clip, no. So unfortunately, pacifier clips are good only when a baby is being supervised. When a baby is being actively supervised, that is the time that you can use a pacifier clip. Now, let's just be aware, actively supervised doesn't mean I'm staring at my baby. Actively supervised means I'm going out with my friends to have lunch and go walk around the park, and I want to have the pacifier clip on the baby's clothes so I don't lose it. Absolutely, because you're checking in on your baby. Where you don't want to use it is you don't want to use it in the car seat when the baby is not like something that you can just directly look at every once in a while. And you don't want to use it in the crib at night. Now, if you are putting your baby in a swing for an hour to nap while you're cooking dinner, that's fine. Okay. But you do want to make sure you're not using it unless the baby's supervised. If any of you guys have a question, please feel free to put them into the chat. I'm going to go ahead and I'm going to answer a couple questions about C-section incisions because a lot of you guys will end up having C-sections. So the first one is, she said tie my tummy after a C-section. I think she means a tummy tuck. And also I have yellow discharge. Is it normal to have sweat on the scar? She also asked, how long should I wait to get pregnant after a C-section? So this was all from the same viewer. Okay, so there's a couple of things here. Number one, let's start with sweat and yellow discharge. These are signs of infection. So I have a couple videos on C-section incisions and stuff that we're going to link into the description. But when you have a C-section, you need to take care of that incision very carefully because infection is a real thing. And if the infection gets too bad, what can happen is the C-section incision can actually open up again, which is just a nightmare and it's very painful. So when you have a C-section, what happens is most of us have like a belly afterwards. When you leave the hospital, you still usually look like you're pregnant. So if you have your belly, right? So this is your belly and this is kind of this overhang and your C-section incision is under here. So it's actually in this closed, dark, moist space, okay? And what needs to happen is you need to multiple times a day lift up this lip so you can see the C-section incision and you need to make sure you clean it, pat it dry, and even give it a little bit of air because this is going to help prevent infection. Now, when you clean this, you don't just clean it with soap. You're going to clean it with like soapy water or warm water, and you're going to rinse it and you're going to pat it dry. You want to make sure you don't use any lotions, powders, anything, because a lot of that has sugar in it, and sugar is the food for bacteria. So if you're putting stuff on there, that's going to feed the bacteria in that nice, dark, moist space, and the next thing you know, you got an infection brewing. So you need to go to your doctor if you have any kind of discharge coming from the C-section incision, because that could actually be a really major sign of infection that needs to get taken care of. Now, how long should you wait to get pregnant after a C-section? You should be waiting to get pregnant in an ideal world for 2 years. It's called baby spacing. It's good for women's health. So understand this, that how long should you wait to get pregnant after a C-section is the same as how long should you wait to get pregnant after having a vaginal birth. Our bodies need a chance to heal and to rest. There is a higher risk for maternal death the closer you have your babies together. It's very tempting because we always talk about like, babies, kids growing up together and being close in age and, maybe logistically it's easier and stuff like that. But a woman's body isn't designed to go through pregnancy after pregnancy after pregnancy. And this increases maternal mortality rate. So really, you should be waiting for 2 years. Now, a lot of people are going to say that that's not really possible. And I should clarify, I'm sorry, 2 years before you start trying. So you're actually waiting almost 3 years to have the baby. Most women will wait a year. That's really good. I would not recommend anything before a year. You might get other healthcare providers to give you some kind of answer. Maybe there's safety data out there. I can tell you that safety goes beyond whether your body can physically get pregnant. There's a lot of things that happen with a pregnancy and with having a baby that are intangible health things. Like what does lack of sleep do for you? Or what does not being able to do self-care do for you? So in my opinion, you should be waiting at least a year or more, no matter what the physical safety data says, because the mental health safety data is, I think, far more important in a lot of respects. So I don't recommend before a year. Finally, can I get a tummy tuck after a C-section? Yes. Anybody can have a tummy tuck. So I am not sure if she's asking how long she would have to wait or something like that. What I will tell you is, for those of you who do want to have a tummy tuck, if you know this ahead of time, honestly, if you're like good with logistics, you might be able to get that all done at once, believe it or not. Okay. There are women who do that. That requires a lot of planning on your part and working with your OB and a plastic surgeon to do it. So, but it can be done. It absolutely can be done. For those of you who are going to have it done afterwards, it's really a matter of your healing. And it's also a matter of whether you're going to have another baby and other stuff like that. So I can't say for sure when you would be able to. For those of you who are joining me, please feel free to put any of your questions into the chat. That's what I'm here for. And for those of you who stick around to the end, I will give you a sneak peek at tomorrow's video. We had a question on yeast infections of the breast. So I have a 3-month-old baby. I had a severe infection on both of my breasts. My nipple is red and I have so many wounds. It's very painful in the breastfeeding and severe pain after feeding. Initially, my areola had small round patch and now it has a bigger one. I consulted 3 doctors and took antibiotics and have muciprocin ointment, but it does not feel better and it's very bad now. So yeast infections of the breast are extremely, extremely challenging to deal with. Usually it will be a breast that's red and shiny and kind of will have some flaky skin and you have these sharp stabbing pains. It can also be itchy. It's awful. Like, they're really bad. The biggest thing with yeast infections of the breast is mom and baby have to be treated at the same time. Okay. You cannot treat one and not the other, because if mom gets treated, the baby still has yeast and the baby will give it back to the mom. And if the baby gets treated, the mom still has yeast and the mom will give it to the baby. So when this happens, it does not matter if baby does not have symptoms or if mom does not have symptoms. If one has yeast, they both need to get treated. Okay. Now, yeast infections of the breast are extremely hard to get treated, and they're getting even harder because yeast infections are becoming treatment resistant. So a lot of doctors are going with diflucan, which is a pill that you take. Now, diflucan is something that normally when women take for a vaginal yeast infection, they may take 1 or 2 pills and that's it. That is not what you do with a yeast infection of the breast. If you are taking diflucan for a yeast infection of the breast, you need to take it for 2 weeks, okay? And this is some of the problems that I see. A lot of women who go to a doctor who's not quite sure what to do will give only the 1 pill, and then that actually does not treat the infection, and then the mom is getting worse, and then she's getting a treatment-resistant version because she wasn't treated properly. Or the baby's also not getting treated, which can be an issue. So make sure that the pediatrician is doing something at the same time. We have the yeast infection video linked. There's a whole bunch of hygiene stuff that you guys have to do to help make sure that you're not getting a yeast infection like aggravation. And then finally, I encourage women who are breastfeeding and having breast issues to go to a breast cancer doctor. I'd like to repeat that. If you are having breast health issues while you're breastfeeding, I encourage you to go to a breast cancer doctor. So I've had to send women over the course of my practice who had different issues with like plug ducts and mastitis where we weren't quite sure, to breast cancer specialists. And of course, that sounds very scary. What I'm going to tell you is that you should consider it like going to your primary care, except primary care for the breast. So when you're breastfeeding, the breasts, they change, the dynamic of it changes, the shape, the feeling, the texture. There's a whole bunch of changes because you're making breast milk. So you have round balls that look like cysts in there, but they're actually just ducts full of milk. And you can have inflammation, you can have hard lumps, and it's very hard to really understand the mechanics of the breast. And a lot of this stuff is very tiny, like teeny tiny microscopic areas of the breast and their effects. Breast cancer specialists are the #1 experts on breasts. If you think about it, their job is to look at these images, which are getting better and better, but are still very complex to look at. and be able to understand at very teeny tiny levels what is going on. Is that a solid thing? Is that a fluid filled thing? Is that potentially inflammation? All this other stuff. They are also the ones who know the best medications to be absorbed into breast tissue. They are the ones that know what should be biopsied and what shouldn't. So if you're having any issues with the breast directly, I encourage you to go to a breast cancer specialist. They will usually be able to get things done very quickly. Okay. And as far as this mom goes, I think you need to have not antibiotics, but diflucan for 2 weeks, but the baby needs to be treated at the exact same time. We're going to be finishing up. I have one last question, but so if any of you guys have anything, please put it in the chat. The last question was a mom who had a question about tearing. So she had a previous episiotomy. So she said her doctor said she was already tearing, so she wanted to do the episiotomy. How do I avoid it again? The worst pain postpartum was the episiotomy, and does an epidural increase the risk of tearing? So an epidural can increase the risk of tearing, in my opinion, depending on how strong the epidural is. So it used to be that epidurals were always so strong you couldn't feel anything. Well, if you can't feel anything, you can't slow down your pushing when you feel pain happening, and then you'll push through stuff and then you end up with like extra lacerations, right? So absolutely not being able to feel what's going on can increase your risk. I will tell you that when you're already tearing, doing an episiotomy is not like an automatic, this is what I'm supposed to do. The evidence says that episiotomies can lead to increased tearing. So we should not be just cutting a woman just to cut. Episiotomies are extremely traumatic. They're extremely, and they have a lot of risks to them. And we have a video on that we can link into the description. So I understand why she wants to avoid episiotomy. But just so you guys know, there are times where episiotomies are necessary. And I have been in some of those deliveries. I have seen very few episiotomies because in the hospitals that I've worked in, they have managed to get episiotomy rates under 5%. So one of the things I would tell you guys is find out what your OBGYN's episiotomy rate is, because you can ask that. We have a video on how to interview your midwife and your OBGYN. I suggest you look at that. What can you do to prevent it? For starters, you can do some perineal massage, okay? You can talk to your midwife or your OBGYN. As long as you're safe and you're not at risk for infection, you can use stuff like Primrose oil, and you can do perineal massage where you take your fingers and you kind of work on stretching the perineum and getting that kind of more lubricated, okay? You can also ask your OBGYN or your midwife to teach your partner how to do it. So, you know, when you're 36, 37 weeks pregnant, which is when you usually start really doing perineal massage, you've got a big, giant belly. It is very hard to see what's going on. It's very hard to reach around. You're also very tired. Your partner wants to help. And believe it or not, a lot of partners can do a really good job at a perineal massage. What you can ask them to do is if you talk to your OB provider ahead of time and you say, hey, would you teach my partner how to do this? They can come to your next appointment and you can get on the table and they can teach them how to do it. Just gentle stretching, and then they can see what they're supposed to do and they can do it well for you. And partners are actually pretty excited to do stuff like that. And it's not a sexual thing, it's just a helpful thing. The other thing you want to ask for is to make sure your provider is willing to use something like mineral oil or something during your birth that will allow for there to be a lot of lubrication. Remember, ladies, when you're having sex, if you don't have enough lubrication, you can have vaginal tearing and vaginal soreness. Same thing here. If you don't want vaginal tearing, make sure there's lots of lubrication. So using mineral oil is a very, very nice way of doing it. The other thing is you want to try to practice the mentality of being able to stop pushing. Okay. Because sometimes your provider is going to ask you to slow down or not push. And that is to help avoid tearing. So it is important for you to be able to try to get yourself into the right headspace to be able to follow those directions. That is a lot more challenging to figure out ahead of time, but you can try to practice that type of idea. But other than that, there is not a lot that you guys can do ahead of time. We have the video. I mean, please check it out, but it's hard to really prevent some things from happening. Okay. Um, I think that's kind of coming to an end. If any of you guys are popping in, please feel free to put any last minute questions into the chat. So our video tomorrow is actually on postpartum pain management. Now, this is actual like names of medications and whether they're safe or not. Okay. I feel very strongly about pain management. I think it's one of the most essential things we can do in healthcare. So please check it out. It's going to give you a lot of information about what to expect, what could be prescribed, and whether it's safe or not, including whether it's safe for breastfeeding. Okay. I am Dr. Samantha, the maternity mentor. I am here every Monday at 9 p.m. Eastern Standard Time to answer all of your questions. I love interacting with you guys live, so please keep it up. We are on Facebook, Instagram, and Twitter for additional content. We will link those into the description of the video. Please share the channel with your friends and family. Please like and subscribe to the channel. It really helps me out. And please hit the notification button so you can get notified of our latest content. We really love interacting with you. For some of my more regular people, they will tell you I answer their questions every single week here. I interact with them online. It's something that I really take a lot of pleasure in doing. If you guys have any videos that you would like to see made, please put a comment either into our live chat or on any video that you happen to watch. I look at every single comment, and many of the videos that I have done are direct requests from you guys. So we definitely take those into account. I really appreciate all of you guys. Have a wonderful Monday night. I'm Dr. Samantha, the maternity mentor. Bye for now.